Hello dear friends, I am Dr. Aman Gupta, Fortis Hospital, Vasant Kunj, New Delhi, urologist, endocrinologist and kidney transplant surgeon. Today we are going to discuss a common problem faced by men, which is namely ulcerations or cuts over the penis. Well, ulcerations or cuts on the penis is a common problem. It has many causes, some are common, some are not so common. What to do as a first aid measure, when to see a doctor, and what will happen if we don't take timely intervention or treatment. Well, cuts can be present as a single cut or multiple cuts. Common causes of such cuts are presence of uncontrolled diabetes in men, due to some sexually transmitted diseases, due to some injury during sexual activity or masturbation, especially in cases where lubrication is not enough, application of some harmful chemicals or use of some harsh soaps, all that can cause cuts over the penis. Commonly such cuts are observed in the foreskin, the loose skin which is hanging in front of the tip of the penis, that is called as foreskin or prepuce in medical parlance, and that is the area where cuts are commonly found and happen because of various ailments. Other places where cuts can happen is head of the penis, which is called as glans, or the shaft of the penis, the length of the penis. As a first aid, wash the area thoroughly with mild soap and water and dab it dry. You can apply some antibiotic cream over the cuts, and if it is very painful, you can apply a piece of ice wrapped in a clean cotton cloth, and that will help in reduction of pain and swelling both. Once it is done, you should contact your urologist, because there can be underlying causes like uncontrolled diabetes, sexually transmitted diseases, or viral infections like herpes, and these problems can be managed easily, and if they are not timely taken care of, the problems can aggravate and produce other complications. So what is the solution for such recurrent ulcer formation or recurrent cuts formation on the prepuce or the foreskin or the shafts? Well, in case of repeated episodes of cut on the foreskin, the best solution is, if it is a long-term problem, if it is recurrent, the best solution is circumcision, where the foreskin is basically removed surgically and the remaining is sutured back. That will help in stopping the transmission of the infection basically, and that will also reduce the chances of having repeated episodes of infection and cuts over the foreskin. Many men do not address these problems out of guilt and fear and shame, and they keep on suffering in silence. The underlying problems like diabetes and sexually transmitted diseases, they can be missed, and they get complicated and produce more problems. So if you have any such issues, you should consult your doctor immediately. Urologist is a person who handles these problems and takes care of these issues. The other common and less common causes of cuts on the penis are trauma during the sexual activity, oral sexual activity, or vigorous masturbation without lubrication. Rarely in young boys, it can happen as a result of trauma due to zipper or in the trousers or knickers, and these can be managed with the help of antibiotic creams, and sometimes if it is bad, circumcision is required, or maybe the suturing of the skin is required. So dear friends, any such issue, contact us, solve this problem, and don't suffer in silence. Thank you so much.